see. Hopefully I won't hang up this time. I mean, stop it. Like I'm talking on the phone. Okay.
Step 5. Attempt defib.
Alright, so defibrillation, when you have an AED, you should make sure that you use it immediately. You're gonna follow the prompts. Like I said, when you turn the AED on, and I keep forgetting to bring my water at home.
Excuse me, please excuse this announcement. If you have not taken your students to lunch, please do so at this time.
No, we went before y'all would have been 300. Alright, so this is an AED trainer. It's not a real AED. The thing you got to remember is to make sure that you turn it on. So this one, I need to change the battery. Let me take this home. Turn the battery. Oh,
I need to start bringing my charger.
how you do it? See, it's not coming on.
What is it?
Call for help now. Remove all clothing from patient's chest.
So once you turn it on, it's gonna tell you what to do.
Pull red handle to open bag. Look at pictures on pads.
So I'm telling you, look at the picture.
Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture.
So how it looks in here, that's what it
Press
tells you.
pad firmly.
So it tells you like
Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Remove all clothing from patient's chest.
Next step.
it's not gonna go because I'm
Pull
not.
red handle to open
It's
the
gonna repeat because I'm not doing anything. So once you turn it on, and it has a remote that I can, but I don't like it. When they put in our new air conditioners and they put the lights in, everything got moved around in here. So. But anyway, that is what an AD kind of looks like. This is a trainer, so it's not gonna actually shock anybody. But like I said, you turn it on and you just follow the prompts. It's gonna tell you exactly what to do. All right, so while one person sets up the AD, the other rescuers should continue with chest compression. So if the person went to get the AD, you're over here, you're doing chest compression in the breast while they're setting it up. They have to work around you. Remember, you don't want to stop compression because that's what's going to get their heart back beating. So you're doing the compression, they're working around you like under your arm, they're setting it up. You want to keep doing that. You don't, hey, who's that? Oh, Princess. You know I know who you love.
Hey, sis.
Good to see you. I miss you.
She's there.
You know Cheyenne's so mean and hateful. Alright. So, you gotta be working around it or whatever. You don't want to stop your compression. So when the AD is checking the heart rhythm or delivering a shock, the rescue should start working on the victim and stand clear. Um, All rescuers present should use a closed loop communication method to indicate that everyone is clear of the victim. Let's see what this says.
Closed loop communication. Closed loop communication involves 3 basic steps.
So basically,
Step 5.
when you're using
Attempt
the AED and it's getting ready to shock, so you got people around the patient and you got this on, it's telling you it's gonna get ready to shock. Before you actually, on this one, this is the shock button, this red button. So before you actually press that button, it'll say shot delivered. You need something? Oh, it'll tell you deliver shot. You need to make sure everybody is clear. You don't want to be touching the patient or you're gonna get shot too. So the person that's operating the AD will just say everybody clear. That means everybody stand back, don't touch the patient, and then it'll say deliver shot. You hit the button, it'll say shot delivered or whatever it says, and then it's seeing if the shot actually works. It's gonna see if it either to give compressions. If you need to give compressions, it'll say resume CPR. If it's a shockable rhythm and it shocks it back and the heart starts back up, then it'll say whatever. I forgot what else it says if you have an actual heartbeat. But while it's analyzing or whatever, you can be checking for a pulse just to see. And normally after you deliver the shot, y'all can check for a pulse to see if you got a pulse, because that's normally that's when it'll come out after you get a shot. So you can check to see if you have one. All right, in a one-person rescue, the chest compression should stop while the AD is being set up and the pad supplied. False. You want to keep doing CPR, keep doing chest compression. You don't want to stop.
Step 6.
All right, so then the last step is you're going to assist to the recovery position. If the victim begins to show signs of return of spontaneous circulation, that means that they actually have a heartbeat back. You don't have to, the shocking and all that stuff is work. If they have coughing, normal breathing, they're moving, you're going to put them in the recovery position. Because remember, you do not want to do chest compression on somebody that has a pulse. That's a bad thing to do. When should a patient be put into the recovery position? When the victim achieves ROSC, right? All right, 2-person. What's the first step? Verify the scene. Okay. We'll check for responsiveness. Yep. Simultaneously, you're going to check for your pulse and breathing. How far is CPR? Attempt defibrillation. You're going to assist to recovery position, right?
Lesson summary. In this one.
All right. Y'all grab your medicine. Grab your medicine.
You heard somebody? You want some minute view now?
I ain't wiped since y'all said. Y'all can wipe the wipes. Oh, let me unlock the door because I want to hear your stuff about this.
Why you ain't here with my dad?
What you get? I was in my car. Doing an adult.
Yeah, I ain't lying. Let's talk about you grab my name. You gonna grab him like this. Look. DJ, look at this. Grab my name like this. No, it's not dog. Go. I just thought about it. Lena. That's lying. Shut up. That just shut. He was like this. Why you keeping a secret? It's really not a secret. One of his girlfriends might be in here, so you better let it know. One of his girlfriends probably be in here, so you better let it know. Now, let me tell you what his mama did. Every time I go over, I feel as though that like she needed a girl to talk to. Okay. I'm saying like every time I go over there, I'm feeling like she needs
If y'all wanna
a girl to talk to.
sorry, if y'all wanna wipe that right here on this back table.
Every time I go over there, she always holds a conversation with me.
You know this thing is recorded. I just wanna make sure you ain't said nothing inappropriate. I don't know, cause I ain't. I'm just saying. Y'all be forgetting. I tell y'all.
And that's gonna be all for this plan, right?
Yeah, it'll be for this class.
Oh, look like it. But she be holding the whole conversation. Like we really talking. It gets me
Alright, so we're gonna look at.
But this chick is embarrassed. She was a number girl.
She ain't got no sons.
Alright, y'all have a seat for a second. We're gonna watch this first. Hit that light for me, Samara.
Sometimes treatment for a cardiac arrest may be delayed, either because of barriers to accessing the victim or because the arrest was not witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a one rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescuer performing compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR without an AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compressions. We'll learn more about how to effectively switch roles in the team dynamics section.
In two-rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be positioned at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice two-rescuer BLS. Follow the video as you practice. We'll work on the full sequence from the point of finding the victim until advanced medical help arrives. We'll pause here for you to get into position for the two-rescuer practice.
Okay, so this is what we're gonna do on this part. Y'all gonna pair up, so this person like in front, just 2 of y'all. We got even. Yes, we got even number of people, so y'all can just work together like that. Just 2 people, so y'all pick which one mannequin. So what we're gonna do, we're gonna start from finding the victim, so that means both of y'all coming up. One person can do, are you okay, you okay, y'all do all that stuff, right? Y'all decide the first time who's gonna be the compressor. So we're gonna do that, and then I think we're gonna do 3 cycles of it, and then the next time we'll switch to the other person. We're not really doing airway, we don't have all this stuff. So you just, the person that's at the head can kind of just act like they're gonna give them mouth rub. So just remember to do the head tilt and little, you can act like you're giving them 2 breaths, and then the other person is just compressing. Alright? Y'all go! Let's go! Shut up!
Gotta shut it. No, I'm doing it.
You go now. So y'all decide who's gonna be the compressor.
Well, you know, you can do that.
Y'all wanna switch. We're gonna go over it again, so. So y'all ready? So y'all working together? We was practicing each other. Tomorrow, I guess work with Artavius. Alright, so everybody got who's doing it first, right?
Yeah.
Alright, cause I have a feeling that somebody person gonna die. That's just my feeling. I feel like somebody person is going to die. I feel like this, but I got faith in y'all. All right, y'all ready?
Okay, wait. So what we gotta the person is right here.
That's the
What we gotta
breathing.
act like we doing? Just like this.
Head tilt, chin lift. You gonna act like you gonna breathe. Not really, but you gonna act like, okay? All ready?
Who running up to the person saying you okay?
Both of y'all. One person can do the tapping, but this.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED.
Somebody take a pulse. What y'all doing? You gotta take a What you taking a pulse at? Lord.
There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
I ain't do good. That's the hell didn't even, the head didn't even go back here.
Did mine come back alive in here?
Oh no, y'all.
I was working. You should have been looking.
I'm trying to look at everybody. All right, y'all. Switch, huh? I guess. You're too lazy.
Teachers, please allow first period young students, first period students of Coach Edwards,
But I hate doing this thing because I have to stand up on the chair.
Ms. Miles, Coach Richard, Coach
What is that?
to the Neil lobby to see their PowerPoint parents portal access.
Coach Richards went with my 8th grade teacher.
Please allow
Because her name Miss
first
Richards.
period
And she said her husband.
first period students of Coach Richard, Coach Edwards, Coach Chris, I'm sorry, Ms. Mack, Ms. Miles, and Coach Keys to the gym lobby. Thank you.
Oh, that's for the chair that didn't get in time. Because I took one out.
Now, it's a little wobbly now. Don't be fumbling on it.
Because I'm a land.
Please don't fall. All right, y'all ready?
When they say two breath, it's
And look, this is what y'all do. Head tilt, chin lift. Okay? Head tilt, chin lift. That's when you're gonna get a breath. All right.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right, head tilt, chin lift, deep breath.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay. Head tilt, chin lift, deep breath.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
All right. I want y'all to look. Okay, I want y'all to look at everybody's medicine and tell me Who right in here?
Me and Sanaya.
No, they is. They is why.
They strict day.
They American is naked. You American.
Oh, baby, mine
Remember, because you're looking for somebody to bring your AED and hook it up, so you need a American. Remember?
We were gonna do that, but I didn't want to.
Just open it. You don't have to take it off. It just need to be open.
But so tall now, baby.
Yo, man.
Probably this a daisy.
Oh, right. You just a torso. Alright, y'all have a seat for a second.
I'm going to sugar.
Yeah, for a second. So when you get ready, remember when you walk up, one person can be like, "Are you okay? Are you okay?" And the other person can go to taking this down. It don't have to be completely all, but at least get to the chest because the AED is coming and needs to be hooked up. We don't got time to be trying to unzip in.
And you can't work through clothes.
You can rip the clothes, but not these. You don't rip
I
these.
said work through.
Oh no, you can't work through clothes. No, rip these. Now sometimes we rip things, we cut things, like if it's an emergency situation. But let's see what's next. What's on here? Let's see.
Here.
Huh?
Can I take this call?
What call is it?
Hey, man. Well, brief, but.
Tell them we in class.
Alright. I think about my food, though.
Ooh, that ain't supposed to be delivered to school. Don't you know?
They coming back to school. I ain't eat, so that's gonna be my food for their people.
Alright, so let's look at high quality CPR real quick, see what they say.
What you'll
It
learn
might be nothing
during
different.
this lesson, you'll recognize and understand the
Alright, let's see if they tell us anything. Alright, so we talked about this earlier. Even when you do CPR, there is a 90% chance, even when you do CPR only supplies about 30% of the normal blood flow needed by the brain. So that's why, like, if you don't do anything, then nothing's gonna happen. At least you got a chance. So, to deliver the best outcome, you should focus on always providing high quality CPR. And that's, chest compressions 100 to 120 beats per minute. Making sure, switching out, making sure you're not getting too tired, because once you get tired, you start being shallow, it's deep. Huh?
Can I post you right here?
Can I what?
I'll post you right
No.
Food.
On the side.
Right
So
here.
that would look like you were doing over here.
Yeah,
But
so
it's on the
I
side.
couldn't reach the neck. Cause the
How
neck
you
was
could? What you?
I had to find the neck. So a person with no neck.
They still got pulse.
I know that. I'm saying she gonna do that with them too, cause she can't see their neck.
Alright, so during a cardiac arrest, the brain is without oxygen. So we know that because we know that the heart has stopped. That's what the arrest means. It's not pumping. So that means nothing is going to the other, organs. So the brain is without oxygen. So we think we talked about it. 4 minutes is when the brain starts getting affected if nothing is happening. Because of this fact and the fact that CPR only supplies a fraction of the oxygen needed, it's important to start CPR as soon as possible. So y'all learning it, even if you know somebody that doesn't if somebody doesn't actually have certification, they do have something called bystander CPR. So even if you never had certification, didn't get BLS certified or CPR certified, you can still at least do chest compression. It's better to do that than to do nothing at all.
Concept 2.
Alright, so chest compressions need to be hard and fast. Even if you call 911, they're going to tell you to, get to a person's bare chest, get to the middle of the chest, put it fast and hard. That's what they're going to tell you to do over the EMS operators. For adults, each compression needs to move the chest at least 2 inches or 5 centimeters. So write that down. Adult compressions need to be 2 inches or 5 centimeters for an adult. Kids is going to be a little bit different. We'll get the kids when we talk about that. So 2 inches or 5 centimeters. So you have to go this deep because it's gonna get a good blood flow. That's what you want to go. Chest compression also needs to be fast. It needs to be at least 100 compressions per minute to get a meaningful volume of blood flow through the body. So they have some songs that you can sing or hum or whatever and play it in your head for compression. Because some people don't know how fast 100 to 120 beats per minute is. Have y'all ever heard, y'all keep going, but I'm asking y'all anyway. Have y'all ever heard of the Bee Gees? You ever heard the song Staying Alive?
Some of y'all probably know it.
Staying Alive. Huh? 2 inches 5 centimeters. Or no. I'm gonna be jumping there back now.
I'm not. No, if I am, I'm gonna pick it up.
Hold on. Alright. Now. You still right? 5 centimeters or 2 inches for adult compression. Alright, so this is how fast you should go.
My job is to make college easier because students have a lot on their. Oh, sorry, coach.
That's the song though. Like staying alive. Yeah, I know that one though.
What's the other song? Hold on. There's a bunch of them. Y'all might know.
Ow. Oh, freaking either I'm pretty or this camera is just so pretty. I think it's me.
Okay.
Y'all remember me from last year? The ugly little girl.
So that the beat of that song is about 100 to 120 per minute, which I need to.
Go to the lyrics. I'm gonna go watch you recording. You better not.
So those are two songs, and they got other songs. Let me see what else y'all might know. Y'all know who Gnarls Barkley is, right?
No.
Okay.
Put it on some Megan.
No, they got, y'all know who NSYNC is?
Them one of them. Escape?
NSYNC.
Uh-uh.
Who y'all know? Oh, y'all probably know none of these.
I probably know. I just don't know the song. Cause I listen to a lot of different types of music.
Respect, y'all know Aretha Franklin, right?
R-E-S-P-E-C-T.
That's another one.
How she said that so fast? I thought she was saying R-E-S-P-C-T.
They don't got none of these mumble rappers y'all listen to.
R-E-S-P-E-C-T.
They got Missy Elliott, Will Smith getting jiggy with it. Y'all know that song, right? Get jiggy with it. Never mind.
I know that song, and I know Miss Elliott music too.
But those are songs that have the correct beat for a chest compression. Alright.
I'm just like, y'all.
But when I first learned it, when we first learned chest compressions, we learned CPR. The Bee Gees "Staying Alive" is the song that they told us to think of, so that's why, like, when I'm compressing, that I'm got "Staying Alive" in my head. All right, so 100 to 120. You should not try to go faster than 120. It has been shown that when compressions are over 120, the compression depth becomes shallower. So if you go too fast, then you're not gonna be as effective. You can't push as hard when trying to keep a very fast rate. So that's lower blood flow. Also, yes, you can break ribs when you're doing compressions. Alright, so a complete recoil allows blood to flow into the heart, a biological process known as venous return. This provides the most blood to be pumped during the next compression. Avoid placing any pressure on the victim's chest during recoil because this impedes venous return and in turn increases blood flow. So recoil is when you push down and come back up. That's the recoil.
Concept.
Alright, so you gotta make sure that you minimize interruption. So we know no longer than 10 seconds. Anything you do, if you're not compressing, checking for a pulse, giving breaths, no longer than 10 seconds. The goal of limiting interruption is to increase the compression fraction. The compression fraction is a percentage of total CPR time during which chest compressions are performed. The goal is to have a compression fraction of 60%. For example, if a rescuer performs CPR for 5 minutes, 60% of that time, or 3 minutes, should be spent giving chest compressions.
Concept 5.
So giving effective rescue breaths, they should be delivered over 1 second and provide enough volume to make the chest rise. So you want to make sure that you're seeing good chest rise when you're giving breaths. So if you have to reposition the head, reposition your mask, or whatever you're giving breaths to, you can do that to make sure that you have a good chest rise. Rescue breaths fill the lungs with air, including oxygen. When blood circulates through the lungs due to chest compression, it absorbs this oxygen, which is needed by the brain. And avoid excessive ventilation. You don't want to go too fast. You don't want to put too much air in. That can, if you do that, it can go into the stomach. And we don't want that, because they might aspirate. Aspirate means things go inside your trachea that's not supposed to go. Like if they throw up, some of that stuff, if they're throwing up, it's coming out the stomach through the esophagus. Well, the esophagus and the trachea are right by each other. So anything that goes down into the lungs that's not air is a no-no. So if they throw up, if you give them too much ventilation, too much breath, and then they end up throwing up, and it can go down into the lungs, and you got some more problems. So you don't want to do that either.
Procedure for.
All right, so we know we're going to give 30 chest compressions. We're going to give 2 rescue breaths. We're going to switch rescuers every 2 minutes. Continue CPR until it's appropriate to stop. We talked about when to stop.
Step.
Got all this stuff, all this.
Step 5.
So we know every 2 minutes, or 5 cycles of the 30-to-2 ratio, you're going to switch. It's going to reduce fatigue. it should take less than 10 seconds. So if you're switching, it should be you just need to go on and switch positions. No longer than everything, any kind of break in compressions needs to be less than 10 seconds.
Steps.
All right, so remember we talked about when you should stop CPR. So these are the things. AED is available. The victim shows signs of ROSC, like coughing, normal breathing, or movement. Care is transferred to an advanced life support team. So EMS arrives, and then you can stop. The rescuers are not able to continue because of exhaustion or the scene becomes unsafe. A valid document stating that resuscitation should be stopped is presented. So that means your patient is a DNR or do not resuscitate. We can stop then.
Rest.
So when you're doing rescue breaths and barrier devices, a barrier device should be used to protect the rescuer from contact with the victim's exhale air or fluids like saliva, vomit, or blood. Two popular types of barrier devices are the pocket mask, and I showed y'all, it was not really a pocket mask, but I showed y'all what it looks like, and the bag mask. The bag mask is the thing I had when I was going into the mannequin. Both come in different sizes for adults, children, and infants, and also the little face shield. That's one too. Huh?
I was looking, I was like, that's his thing.
The proper size needs to be used on the victim. The mask should cover the victim's nose and mouth without covering the eyes or going past the chin. So if you got an adult one of these, you're probably not going to be able to put it on a kid because it's going to be like all over their face, depending on how big or how old the kid is.
Using a pocket.
So this is what the pocket mask looks like. Like I told y'all, it has this valve in here, so it's preventing you from breathing in their air. You're giving them air, but it's preventing you from getting it back. That's just been mixed with them, which sounds gross. So you'll choose the appropriate pocket mask size and position yourself at the victim's side. You're gonna place the pocket mask over the victim's nose and mouth. So I showed that the narrow part goes on the bridge of the nose, and the wider part goes on the chin. And I told you about the C and the E. So those three fingers that go on the chin, that's your E. Your C is up here.
4. Perform.
So head tilt, chin lift. You're gonna open the airway. If they have neck or spinal trauma that you think of, you're gonna use a jaw thrust maneuver instead. This is best used if you have 2 rescuers. If you can't get it to work, it doesn't open the airway, then you're just gonna have to use a head tilt, chin lift. Like we said, no more than 10 seconds.
5. Deliver 2 smooth rest.
When you have 2 or more rescuers, it's best to use a bag mask.
Using a bag mask with 2 rescuers.
That's this one, the one I used the other day. It can deliver more oxygen, but the only thing is you have to have oxygen that is attached to it. So this end connects to oxygen. So that's why it's not just gonna be one of these laying around. If you get the hospital, it's gonna be on the EMS. So this part, goes on the patient. This part it hooks to like an oxygen tank, or if you're in a hospital, it goes on that thing on the wall where it has oxygen through it. So like I said, you got the EC technique. That's what I was doing. Here's your C, and then here's your E, with your 3 fingers. Like, so you got it here. And you got your C, which is trying to hold here, and then you got your your E up under here that's holding the seal. And sometimes it's hard because, like, if you got small hands, it's hard. But if you got another person that's there, like when you're having a cold in the hospital, it's a gazillion people, another person can hold while you press the air.
4. Perform a head tilt. Using a bag mask.
Alright, so when you have 3 people, 3 or more, that's what I was saying. Like here, they're holding, and you're gonna get a better feel, and then the air gonna go back down. So if you got more people, you got more hands, you can get 2 people to do this part. So, but they'll use, instead of one hand with the C and the E, it'll be both. So you got your C on this side, your C here, and your E right there. So they're doing it with both hands. And then, so rescue breathing without barrier devices. That means you don't have a mask, you don't have a pocket mask, you don't have a barrier device. Many cardiac arrests happen at home or in other settings where the proper rescue equipment is not readily available. These situations, you may not have a barrier device, so the rescuer will need to give mouth-to-mouth rescue breath. I don't advise mouth-to-mouth, but if that's what you want to do, that's your business. The rescuer might be worried about infections when coming in physical contact with the patient. However, studies have shown that the chances of this occurring are extremely small. So, to give mouth-to-mouth, you're going to open the victim's airway using the head tilt chin lift. You're going to use the hand on the forehead, pinch the victim's nose shut. Let's see, like that.
2. Using the hand on the.
So, you got the mouth open, you're going to pinch their nose shut.
So
And
the air won't go out the nose?
Huh?
So the air won't
Right.
go out the nose?
Because it's kind of like, because you know it curves. So, like, if you put something in somebody's nose, it can come out the mouth. Now, we can suction, like respiratory therapists suction people in their lungs. We can go down their nose, but you got to have the right maneuver for it to go down into the trachea. But sometimes if you don't do it right, so it's kind of like a little curve, it'll come back out. So like if you're blowing air in here and this is not covered, the air's gonna come. So that's to keep the air in going down into the lungs. So you're gonna take a normal breath, seal your mouth over the victim's mouth, blow into the victim's mouth, delivering 1 rescue breath over 1 second while watching for chest rise. So you'll blow in their mouth and you're still looking for chest rise, like as if you're using some kind of device. So you'll break the seal.
3. Take a normal breath and seal your mouth open.
So that's how he's sealing his mouth over hers or its or whatever that is. And you're going to break the seal, take a normal breath before resealing your mouth and delivering another breath. So break the seal means like taking your mouth off, getting you some air, and then doing it again for the 2 breaths.
Lesson 7.
Okay, AEDs.
What you'll learn in this. What is an AED?
Alright, so AED is a portable medical device that automatically analyzes a victim's heart rhythm during a cardiac arrest and determines if it's a shockable rhythm. So what are the 2 rhythms I told y'all are shockable? VTach. So you got ventricular tachycardia and you got ventricular. I'm trying to see if I see the word up there.
Please receive this announcement. Teachers, please send Coach Wooten's first period class to the gym lobby. Thank you.
Well, it sounds like she be in a hole all the time. So you got ventricular tachycardia or VTach, and you got ventricular fibrillation, the VFib. Oh, they're both right here. I see them. So these are the 2 that's gonna shock. So you got VFib, which is VF, and you got VTach, which is VT. So it says, American Heart Association says that about 25% of out-of-hospital cardiac arrest victims have shockable rhythms. So early use of an AED greatly increases the victim's chance of survival. Over 50% of cardiac arrest victims who receive rapid defibrillation survive to the hospital discharge. So doing chest compressions, high quality CPR, using an AED proves to be successful.
Using an AED.
Alright, so there are several AED manufacturers, each with many different models. Although there are some differences between the models, they all basically operate the same way and provide voice instructions when used during a cardiac arrest. Like I showed you how this one turned on. You're gonna use the following steps to operate an AD for adults and children aged 8 years and older. You're gonna power on the AD. First step, the first thing, and I know this is gonna be a test question on the actual written test. It's gonna ask you, you get an AD or something. It's gonna ask you what's the first step. First step is always gonna be to turn it on, because if you don't turn it on, it's not gonna talk to you and tell you what to do. So first thing you need to do is make sure you turn it on. You're gonna attach the pad. You're gonna let it analyze the heart rhythm. So while you're still doing CPR, while one person is turning the AD on, putting the pads on, and it's gonna start analyzing. When it tells you to shock, you'll deliver a shock. If it doesn't tell you to shock, then you're gonna just keep on with CPR. You're gonna immediately restart chest compressions after the shock is delivered. You're gonna repeat rhythm analysis when prompted by the AED. So the AED is going to analyze every 2 minutes.
Step 1.
Oh, which one? The first step?
Using an AED.
Oh, okay.
Feel like there's gonna be a quiz on Friday. I just feel it in my spirit.
Students, just a friendly reminder prior to the bell ringing. The bell will ring in 4 minutes.
She wanted to write it down.
We will continue our evening academy registration this afternoon from 3 to 6 p.m.
I feel like it's gonna be a
sure to
quiz,
bring
right?
your parents. Remember that evening academy gives students the opportunity to make up any missed credit during our high school years. If you're in 11th grade, however, you may have 5 12th grade courses, 2 or 3 11th grade courses. High school will give you the opportunity to make up those courses. Additionally, students, there is going to be an online option for night school students. When you come, please make sure your parent is with you to fill out that information. However, they must agree to everything that's on that.
It's gonna be an online school for night school option.
I will see you this afternoon, / this evening for night school registration from 3 to 6 today and tomorrow. Thank you.
Don't worry, Grace Nelson, I got this. Yeah. Miss Cameron. Why he not puffing up like you got him puffing up?
Because you gotta have 2 hands on there.
This is the
And I don't know who sit down and try to give a patient a breath.
Different than league schedules, and they're all the traditional heights. Therefore, some of those impact kids will get off the bus prior to the bell ring. All students who are here early because the impact bus returns those students must report this to me. That is where students are to go who are getting off on the impact bus because they're leaving earlier than our bell schedule. The impact kid is in the building. If you're here before the bell rings to go to your next period class, you are to report to the gym. That is the holding place for early impact kids when they return. Thank you.
Y'all look over y'all's bell ringers y'all had. Any notes y'all written down for Friday. Y'all probably have a test at some point. I mean a test, a quiz, whoever. One of them.